Hello guys, I hope you are all doing well across the globe. Below is one of frequently asked question. My dog has not been well since yesterday. She's dull, not as active as it used to be, has black and watery stool, and will not eat. She will drink water and drools a lot. She has not gotten into any poisons, but may have eaten something from the trash. I do not have a vet available. Is there any unconventional treatment for my dog? So what to do when there is no vet available? Ideally, your dog would be examined, and a veterinarian could determine how bad the dehydration has progressed, put your dog on IV fluids, and prescribe GI antibiotics to keep her alive while she recovers. But I realize that where you live, and in many parts of the world, no veterinarian is available. So what can you do at home? The main cause of death in dogs suffering from vomiting and diarrhea is multi-system organ failure secondary to dehydration. Therefore, the first thing you should do is keep your dog hydrated. You should not wait until your dog has clinical signs of dehydration, tenting skin, dry gums, sunken eyes, and do your utmost to provide fluids now. Since you are not going to be able to put in a catheter and give IV fluids, the best alternative method is to give your dog subcutaneous SQ fluids, but it will give you an idea of what you need to give fluids at home and will tell you how to do it. You may need to give the fluid in 2 spots, usually in that loose skin around the shoulders. The correct dose is 10 to 30 milliliters per kilogram. The next thing to do at home is treat the garbage toxicosis, better known as garbage gut. Visit your local pharmacist and find out what kinds of medications are available. There are specific antibiotics for GI infections. One of them, generic metronidazole or Flagyl, does have side effects but is able to treat several of the infections that might be giving your dog diarrhea. The last thing you can do at home is to provide her with palatable food that she is going to eat to bulk up her stools. Several veterinarians suggest rice as it is bland, but not all dogs will eat it. Pumpkin is another good bulky food, but again, not all dogs will eat it, so I prefer to use the following multi-ingredient recipe. Lentils. This is a high-fiber food, so I usually cook about a half cup. Do not add any onions or spices when cooking it. It should be served warm, not hot. Pumpkin. Add a few tablespoons or a nice fist-sized chunk. If you have summer squash, it is also fine, but if you have to buy canned pumpkin, make sure it is not the pumpkin pie mix, which has many spices added. Chicken breast. 1 breast is fine, but make sure it is cooked and chopped up fine enough to mix in with the lentil mixture. Liver. Add about 100 grams, just enough to make the food smell attractive to your dog. This adds some vitamins, but is not what a dog with diarrhea needs. I mainly add it because dogs appreciate the smell. Parmesan cheese. If your dog is not interested in the lentil mixture, I sometimes sprinkle this or garlic salt on top to increase their interest. Neither of these things are needed. Once she is better, you really need to check with a pet shop and see if there are any general dewormers available. This video is not meant to substitute for diagnosis, prognosis, treatment, prescription, or formal and individualized advice from your veterinarian. Animals exhibiting signs and symptoms of distress should be seen by a veterinarian immediately. Once again, thank you for watching the video. If you find value in this video, please subscribe to our channel, comment, like, and share the video.